What if the way you sleep tonight could quietly increase your stroke risk by up to 40% without you even realizing it? Most people over 60 have no idea this is happening. Poor circulation doesn't make noise, it works in silence. And every night, millions of seniors unknowingly sleep in positions that put extra strain on the heart, slow blood flow, and silently increase the risk of dangerous blood clots. I'm Dr. James Richardson, an interventional cardiologist with 19 years of experience treating stroke survivors. I've seen patients come into my clinic after preventable strokes, and when we trace back their habits, one sleeping position shows up again and again. Now, I'm not going to reveal which position it is just yet, because first you need to understand the science of why this happens. Your brain's blood flow changes dramatically while you sleep, and certain positions create a perfect storm for clot formation. The entire solution fits in one sentence, but that sentence needs the science behind it, or you won't believe it enough to act on it. So I need you to stay with me until the end, because the science is what makes this impossible to ignore. And the science starts now. Let me tell you about the patient who made me realize how dangerous this sleeping habit really is. It was a Tuesday morning when Margaret came into the emergency room. She was 67 years old, unconscious, found by her husband at 6 a.m. when he woke up for work. The paramedics told me she had been completely healthy the day before. No warning signs, no obvious risk factors, active, independent, took her daily walks around the neighborhood. But when I looked at her brain scans and started asking questions about her habits, I found something the standard stroke checklist had completely missed. Her sleeping position had been slowly damaging her blood vessels for decades, and that morning, everything finally caught up with her. And here's what concerns me. This same pattern could be happening in your body right now while you sleep, and you might not feel a single warning sign until it's too late. But before I tell you what happened to Margaret, you need to understand what was happening inside her brain every single night. Your brain needs 20% of your body's blood supply, but what happens when your sleeping position cuts that off? Let me explain something most doctors don't discuss during regular checkups. Your brain gets blood from two main highway systems. The first is the carotid arteries in the front of your neck. Those are the ones doctors usually check. But the second system runs along the back of your neck, through your spine. These are called the vertebral arteries, and they're the ones that get compressed when you sleep in certain positions. Here's what happens. When you sleep with your neck rotated or bent in specific ways, these vertebral arteries get squeezed. Blood flow drops. According to a study published in the Journal of Sleep Research, certain sleeping positions reduce blood flow to the back of the brain by up to 40%. That means your brain is running on 60% of the oxygen and nutrients it needs for 6 to 8 hours straight, every single night. Now, your body tries to compensate. But here's the problem. When blood flow slows down that much for that long, the blood starts to pool. It gets thicker, and in those slow-moving pools, clots can form. This is basic physics, slow-moving liquid clumps together. Now add in something else. The American Heart Association tracks when strokes happen most often during the day. The peak time is between 3 a.m. and 6 a.m. That's not a coincidence. That's when your body has been in that compressed position the longest, when your blood pressure drops during deep sleep, and when clot formation reaches its highest risk. And this mechanism gets even more dangerous when you combine it with something most people over 60 already have. Here's how to know if this is already affecting you. Most people dismiss these as nothing. Do you feel dizzy when you first stand up in the morning? Does your neck feel stiff when you wake up, but then it loosens up as the day goes on? Have you ever had brief moments of blurred vision right after waking? What about unexplained headaches at the back of your head that seem to happen in the morning? Or that foggy feeling where you just can't think clearly for the first 30 minutes after you get out of bed? These are not normal parts of aging. These are warning signs that your brain is not getting enough blood flow during the night. Your vertebral arteries are telling you something is wrong. I want you to do something right now. Type "yes" in the comments if you've felt any of these symptoms in the past month. I read every comment, and I want to know how many of you are already experiencing this. If you've felt even one of these, what I'm about to show you in the science is already happening in your body. Here's the frustrating part. Most doctors never ask about sleeping position during stroke risk assessments. When you go in for a stroke prevention checkup, your doctor checks your blood pressure. They run your cholesterol numbers. They ask if you smoke. If you're over 65, they might check for atrial fibrillation, which is an irregular heartbeat that increases stroke risk. All of this is important, but sleeping position is not on that checklist. Why not? It's not because doctors don't care. It's because medical training is divided into specialties that don't always talk to each other. Cardiologists focus on the heart. Sleep medicine doctors focus on sleep apnea and insomnia. Neurologists focus on the brain. But the connection between sleeping position and stroke risk falls into a gap between all three specialties. There's also no billing code for it, which means there's no financial incentive for doctors to spend time on it during a 15-minute appointment. Here's something interesting. European neurologists have been studying this connection for years. They have published research on something called positional vertebrobasilar insufficiency. That's the medical term for not enough blood getting to the back of your brain because of how you're positioned. But in the United States, this research hasn't made it into standard practice yet. This isn't about conspiracy. This isn't about doctors hiding information from you. It's about siloed medical specialties, time constraints, and gaps in the system. But the result is the same. Most people never get warned about this risk until after a stroke has already happened. And when you see what happens to patients who ignore this, you'll understand why I'm so passionate about getting this information out. Remember Margaret? Here's what we discovered when we dug into her case. Margaret Thompson was a 67-year-old retired elementary school teacher from Austin, Texas. That Tuesday morning, she woke up at 6 a.m. unable to move the right side of her body. Her speech was slurred. Her husband immediately called 911, and the paramedics got her to our emergency room within 45 minutes. We ran a CT scan, and it showed a posterior circulation stroke. That means the clot had formed in the vertebral system, the blood vessels at the back of the brain that I told you about earlier. Once Margaret was stabilized, I sat down with her and her husband during recovery and asked detailed questions about her habits. That's when she told me she had been a stomach sleeper her entire life. Always turned her head to the left, every single night. For more than 40 years, we did vascular imaging to see the condition of her arteries, and here's what we found. Her right vertebral artery showed chronic compression damage. Decades of sleeping with her head turned left had squeezed that artery night after night. 8 hours per night, times 365 nights per year, times 40 years. The cumulative damage had finally triggered a clot. Margaret went through rehabilitation. She regained most of her function, but not all of it. Her right hand still has some weakness. But here's the important part. I taught her how to sleep differently. 3 years later, she has had no recurrence, no second stroke. This was not a miracle. This was biology doing exactly what it's supposed to do when you stop working against it. Now that you understand one real case, let me show you the 3 positions that cause this, and one is far worse than the others. Not all sleeping positions are equally dangerous. Here's how they rank. Position number 3 is sleeping flat on your back with no pillow under your head. This position carries a mild stroke risk, but not because of vertebral artery compression. The problem here is that your tongue can fall backward and partially block your airway. This leads to sleep apnea, which means you stop breathing repeatedly during the night. When you stop breathing, your oxygen levels drop. Chronic low oxygen, what doctors call hypoxia, damages blood vessels over time and increases stroke risk indirectly. So if you sleep flat on your back with no pillow and you snore heavily, this position is working against you. Position number 2 is side sleeping with your arm tucked under your pillow or your head. This is a moderate risk position. When you sleep like this, you compress the subclavian artery that runs under your collarbone and supplies blood to your arm. Reduced circulation in that arm for hours every night can contribute to clot formation over years. But here's the bigger issue with this position. Most people who sleep like this also rotate their neck significantly to get comfortable. That neck rotation puts stress on the vertebral arteries, which brings us closer to the real danger. Now, the worst position does something far more dangerous. It combines sustained neck rotation with compression and gravity, all working against your brain at the same time. Most people don't realize they move during sleep, and that's true. But research shows that your primary sleeping position, the one you fall asleep in and return to most often, is what matters most for long-term health. But there's one position that combines all these problems into a single deadly habit, and I see it in 60% of my stroke patients. The most dangerous position is sleeping on your stomach with your head turned to one side. Here's why this position is so harmful. When you sleep on your stomach, your head must turn 45 to 90 degrees to one side so you can breathe. You can't sleep face down into the pillow, so your neck stays rotated in that position for hours. That sustained rotation compresses the vertebral artery on one side of your neck. Now add gravity. When you're on your stomach, gravity is pulling blood away from your brain instead of helping it flow upward. And finally, this position gets maintained for hours without relief. You're not shifting. You're not adjusting. Your vertebral artery is squeezed shut while your brain is trying to function on reduced blood flow all night long. A study published in the journal Neurology followed thousands of adults over 10 years and found that habitual stomach sleepers had 2.3 times higher incidence of posterior circulation strokes compared to back or side sleepers. That's not a small difference. That's more than double the risk. Now, I know why people sleep on their stomachs. Some of you have chronic back pain, and stomach sleeping relieves pressure on your lower spine. Some of you have done this since childhood, and it feels impossible to change. Some of you find that it stops your snoring, so your partner prefers it. I understand all of that, but here's what I need you to understand. Even side sleeping with extreme neck rotation carries similar risk. This is not about one bad night. This is about cumulative exposure over decades. Every night you sleep in this position, you are adding stress to those blood vessels. Knowing this isn't enough, you need to understand exactly how to transition out of this position safely, which I'll show you next. Here's exactly how to retrain your sleep position. I've used this protocol with hundreds of patients. Week 1 is all about the wedge system. You're going to need 2 pieces of equipment. First, a medium firm body pillow. Second, a foam wedge that creates about a 30-degree angle. You can find both of these online for under $60 total. Here's how you use them. Place the foam wedge under your torso from your hips to your shoulders. This creates an incline that physically prevents you from rolling onto your stomach during the night. Then take the body pillow and hug it to your chest. This gives you something to hold on to, which provides comfort and helps your brain accept the new position. Your goal this week is simply to prevent stomach rolling, even if your sleep quality drops a bit. That's normal during transitions. Week 2 and 3, you're going to train yourself into proper side sleeping. Sleep on your side with a pillow placed between your knees. This keeps your spine aligned and prevents hip and lower back pain. Use a cervical pillow to keep your neck in a neutral position with no rotation. A cervical pillow has a curved shape that supports the natural curve of your neck. If you don't have one, you can roll up a small towel and place it under the curve of your neck for support. The key here is that your head should be level with your spine, not tilted up or down, and definitely not rotated. Week 4, if side sleeping still feels uncomfortable, you can try back sleeping as an alternative. Use a slight incline of 15 to 20 degrees. You can achieve this with an adjustable bed base, or just use a foam wedge under your upper body. Place a pillow under your knees to reduce pressure on your lower back. Use a thin cervical pillow to maintain the natural curve of your neck without pushing your head too far forward. Here's your equipment list. A cervical pillow will cost you $30 to $60. A body pillow costs $20 to $40. A foam wedge costs $50 to $100. Or if you want a full adjustable bed base, expect to spend $200 to $300. Most people adjust to the new position within 3 to 4 weeks. Set a reminder on your phone to check your position right before you fall asleep each night, and track your morning symptoms in a journal or notes app. Dizziness, headaches, neck stiffness. You should start seeing improvement within 2 weeks. But even if you follow this perfectly, there are 3 mistakes that will sabotage your progress. Let me show you what they are. Let me tell you about Robert, who changed his position before a stroke happened. Robert Chen was a 62-year-old software engineer from Seattle. He came to my cardiology office because his father had suffered a stroke at age 68, and Robert wanted to do everything possible to prevent the same outcome. During our appointment, I asked him about his sleeping habits. He told me he had been a stomach sleeper his entire life, always with his head turned to the right. I ordered a vascular ultrasound to check his vertebral arteries, and the results showed early signs of compression. No stroke had occurred yet, but the damage was beginning. I walked Robert through the same protocol I just gave you. He started with the wedge system and body pillow. The first week was rough. He told me he barely slept. But by week 2, his body started adjusting to side sleeping with proper pillow support. At his 6-month follow-up, Robert reported that his morning dizziness was completely gone. The neck stiffness he had been experiencing for years had disappeared. At the 2-year mark, we did a repeat vascular ultrasound. The imaging showed improved blood flow. The early compression signs had reversed. Robert told me, "This was the hardest habit I ever changed, but honestly, I sleep better now anyway." This was not a miracle. This was physics doing exactly what it's supposed to do when you stop working against it. Robert succeeded because he avoided the 3 mistakes most people make when trying to change their sleep position. Most people fail at changing their sleep position because they make one of these 3 mistakes. Mistake number 1 is going cold turkey. They try to force themselves into a completely new position on night 1, and they lie there awake for hours feeling uncomfortable and frustrated. By the end of the week, they give up and go back to stomach sleeping because they're exhausted. The solution is gradual transition with props. Use the wedge. Use the body pillow. Give your body time to adapt. This is a marathon, not a sprint. Mistake number 2 is using the wrong pillow height. They grab their old flat pillow, or they use a pillow that's way too thick, and either way, they create a new neck rotation problem. If your pillow is too flat, your head tilts down toward the mattress. If it's too thick, your head tilts up away from your spine. Both of those angles put stress on your vertebral arteries. The solution is a cervical pillow that's fitted to your shoulder width. For most people, that means a pillow that's about 4 to 6 inches thick when compressed under the weight of your head. Measure the distance from your mattress to your neck when lying on your side. That's your target pillow height. Mistake number 3 is ignoring pain signals. They push through shoulder pain, hip discomfort, or lower back aches because they think they just need to toughen up and adjust. But pain is your body's way of telling you that something is misaligned. The solution is to adjust your pillow placement, add a knee pillow for side sleeping, or try a different firmness level. If chronic pain is preventing you from changing positions at all, that's a sign you need to address the root cause, whether that's physical therapy, a new mattress, or a medical evaluation. Now that you know what to do and what to avoid, let me give you a simple timeline to follow. Here's exactly what to do tonight, this week, and over the next month. Tonight, before you go to bed, check your current sleeping position. If you have a partner, ask them to notice how you sleep, or set up your phone to record a time-lapse video of yourself sleeping for a few hours. You need to know what your baseline is. Then order a cervical pillow and a body pillow online. Don't wait. Do it tonight. This week, when your pillows arrive, begin the wedge system. If you don't have a foam wedge yet, you can temporarily use extra pillows to create an incline under your torso. Track your morning symptoms in your phone's notes app. Write down if you feel dizzy, if you have a headache, if your neck is stiff. Your goal this week is simply to prevent yourself from rolling onto your stomach, even if your sleep quality dips temporarily. Week 2 through 3, transition to side sleeping with proper support. Sleep on your side with the pillow between your knees and the cervical pillow under your neck. You should start noticing that your morning symptoms are improving. If your pillow feels wrong, too high or too low, adjust it. This is trial and error, and that's normal. Week 4 through 30, the new position should start feeling automatic. Your body will begin defaulting to side or back, sleeping without conscious effort. Reassess your morning symptoms at the end of 30 days. If you're high risk, meaning you have a family history of stroke, high blood pressure, or you're over 70, consider scheduling a follow-up appointment with your doctor for a vascular ultrasound to check your vertebral artery health. Before you start, I need to tell you something important about why this matters beyond just stroke prevention. Here's what this is really about. It's not just your brain, it's your independence. When we talk about stroke prevention, we're not just talking about staying alive. We're talking about staying independent. According to research, 60% of stroke survivors lose independence in daily activities. That means they need help getting dressed, cooking meals, going to the bathroom. That's not just a health issue. That's a dignity issue. That's your autonomy. That's whether you remain in control of your own life, or whether you become dependent on your children or a nursing facility. You are not powerless here. Small changes compound over decades. Changing how you sleep is hard, I know that. Sleep is one of the most automatic things your body does, and retraining a lifelong habit takes effort. But if it takes you 8 weeks instead of 4, that's completely fine. You're still protecting your brain. You're still reducing your stroke risk. There is no deadline here. Your body has been trying to tell you something with those morning symptoms. The dizziness, the neck stiffness, the foggy feeling. Now you're listening. Now you understand what those signals mean. And now you have the tools to do something about it. If you know someone over 60 who sleeps on their stomach, share this video with them. Not because it helps my channel, but because it could genuinely save their life or prevent them from losing their independence. Subscribe to this channel for more cardiology insights that your doctor doesn't have time to explain in a 15-minute appointment. I break down the science of heart health and stroke prevention in ways that are actually useful in your daily life. Tell me in the comments, what's your current sleeping position? Are you a stomach sleeper, a side sleeper, or a back sleeper? Let's build a community of people taking stroke prevention seriously. And here's my challenge to you. Come back to this video in 30 days and comment your results. Tell me if your morning dizziness improved. Tell me if your neck stiffness went away. I read every single comment, and your story might be exactly what someone else needs to hear to finally take action. Take care of your brain. It's the only one you have.